Hello everyone, welcome to ANVI'S Physiotherapy channel. In this video, I'll be talking about classification of fracture. So before we move into the topic, for more physiotherapy related topic, press the bell icon and subscribe to the channel. Before we get into the classification of fracture, let us know what is a fracture. A fracture is nothing but a break in the continuity of the bone. It can be caused due to multiple reasons like fall or due to excessive stress on the bone or even due to an underlying disease in the bone. Now that we have learned what is a fracture, now we will move on to different classification of fracture. So the fracture can be classified upon their displacement, contact with the external environment, pattern and their complexity. So first we will learn the classification that is based on displacement. So under this we have two classifications. One is undisplaced fracture, second one is displaced fracture. So first we will learn what is undisplaced fracture. So in this type of fracture there will be a break in the bone, but the broken bone will not leave the alignment. That is, it will remain within its alignment. So these type of fractures are treated usually with a splint, brace or a cast. Next will be displaced fracture. So this type of fracture, there will be a break in the bone, but the broken fragment will move out of its alignment. So as we can see in this picture, the first picture represents the undisplaced fracture and the second picture represents the displaced fracture. So you can see in the first picture, there is a fracture in the bone, but the bony fragment, that is the fractured fragment, has not moved out of its alignment. Whereas in the second picture, you can see there is a fracture in the bone and the fractured fragment has moved out of its alignment. Next, we will move on to the classification based on the relationship with the environment. So they are classified into two types, closed fracture and open fracture. Now what is a closed fracture? It is a type of fracture in which there is a broken bone but the soft tissue and skin which is surrounding the fracture site is intact. That means there is no external wound present around the fracture site. Whereas when we are talking about an open fracture, the soft tissue and the skin that is surrounding the fracture site is involved. That means there is a broken bone and an external wound is also present around the fracture site. In this type of fracture, what will happen? The fractured fragment can pinch the soft tissue as well as skin that will expose the fracture fragment to the external environment. So what will happen? There will be a high risk of infection in these type of cases. So open fractures are treated either with an internal fixator or an external fixator. It totally depends on the external wound that is present. So if the wound is severe and the wound is not ready for an internal fixator, the external fixators are applied and wound care will be continued. So we learn about what is an external fixator and how it will be inserted in the further classes. So in this picture, you can see how an open fracture looks like. Next, we will move on to the classification of fracture based on etiology. So in this, we have three types. First one is traumatic fracture, second one is pathological fracture, and third one will be stress fracture. First, we will learn what is traumatic fracture. So in these type of fractures, it is caused due to excessive stress on the bone. For example, a direct blow to the tibia in an RTA. So next one will be pathological fracture. So let us take when there is a disease in the bone, let us say metastatic cancer of bone or osteoporosis. The bone will become weak. In this type of cases, the bone can break easily even with a minimal injury. Like accidentally if you hit your hand to the wall, or let us take when you stumble while walking can also cause crack in the bone. Next one will be stress fracture. These type of fracture are caused due to overuse. There will be a small crack in the bone. The person with this type of fracture will present with pain, tenderness and swelling, where the pain is reduced at rest and aggravated with physical activity. When X-ray will be taken, often it is difficult to see a tiny crack in the initial days. In the later days, when the fracture starts to heal, the callus formation can be seen around the fracture site. This is how a stress fracture looks like in the healing stage. Next, we will move on to the classification based on complexity. So, under this, we have two types. First one is simple fracture. Second one will be complex fracture. So, first we learn what is a simple fracture. So, in simple fracture, there is a break in the bone, but only at one side. Next, we will learn about what is complex fracture. So, in this type of fracture, the bone is broken into multiple fragments. Next, we will move on to the classification of fracture based on pattern. Under this, we have five types. First one will be transverse fracture. The fracture line will be perpendicular to the long axis of the bone. That is, the fracture line is horizontal. So, these type of fractures are caused by either tapping or bending kind of force. Second one will be oblique fracture. The fracture line will be angulated in a slanting position. They are also caused by a bending type of force. Third one will be spiral fracture. In this type of fracture, the fracture line will run in more than one plane. The fracture will resemble a staircase or a corkscrew. Fourth one will be comminuted fracture. In this type of fracture, the bone will be broken into many segments, that is multiple segments or fragments. Next, the fifth one will be segmental fracture. In this type of fracture, one bone is broken at two different levels. Next, we have green stick fracture. This type of fracture is commonly seen in children. The bone will bend and crack on one side, leaving the other side intact. It is a type of incomplete fracture. So, why it is most commonly seen in children is because the bone of the child has a large quantity of collagen, which will make it more softer and easy to break. So, in this picture, you can see how a green stick fracture will be seen. Now that we have learned about different classification of fracture, let us try naming the type of fracture in the first picture. Yes guys, you are right. It is a transverse and displaced fracture. Now, let us name the fracture in the second picture. Yes guys, you are right. It is an oblique fracture. So now I have put up few x-rays. Name the type of x-ray in the comments below, and also don't forget to let me know which topic you want to learn next in the comments.